Denise Natalini says she suffered excruciating period pains for more than 2 decades.
It's to the point where I was on the couch in the fetal position sweating.
But doctor after doctor brushed her symptoms off.
My quality of life was terrible to the point where I no longer could teach.
It turns out the now 50-year-old had endometriosis, a gynecological condition where endometrial tissue grows outside the uterus, causing pelvic pain, soreness during sex, heavy menstrual bleeding, cramping, and even infertility. It's estimated 1 in 10 women suffer from endometriosis, but in Canada, it takes upwards of 5 years on average to get a diagnosis. Toronto gynecologist Dr. Nicelio Lemos, who finally treated Natalini, says he has a 500 patient waitlist alone.
Time between referral and surgery with me today is at 3 years because we simply don't have enough people.
Lemos was recruited from Brazil in 2017. He says Canada is years behind in terms of testing and is still using an invasive abdominal surgery rather than the new standard, an MRI.
I was shocked to hear the term diagnostic laparoscopy, which I hadn't heard for at least 15 years in Brazil.
Experts say the fix is government funding. Health Canada says the onus is on provinces and territories.
The funding is lacking, the understanding is lacking, the advocacy is lacking, and really the result is substandard care.
Leaving more than an estimated 1 million women like Natalini to advocate for themselves.
They just didn't listen to me, and it's not normal to have this kind of pain.
Or risk suffering for years without ever knowing why. Jamie Maraucher, Global News, Toronto.